prostate cancer remains one of the most common malignancies affecting men worldwide, particularly those over 40. Despite its prevalence, many men remain unaware of the early warning signs that could lead to life-saving early detection. I'm Dr. Michael Harrison, urologic oncologist specializing in prostate health, and today I want to share critical information about 3 key warning signs that might indicate prostate cancer development. What makes prostate cancer particularly challenging is its often subtle onset. Many men experience gradual changes they dismiss as normal aging. Yet understanding your body's signals could mean the difference between early intervention with excellent outcomes versus delayed diagnosis when treatment options become more limited. Each year in the United States alone, approximately 2 to 48,000 men receive prostate cancer diagnoses, with risk increasing substantially with age. By age 80, more than 80% of men have at least some cancerous cells in their prostate, though many cases never progress to clinically significant disease. Let's explore the 3 cardinal warning signs of prostate cancer, understanding their mechanisms, variations, and what differentiates them from more benign conditions. By recognizing these signals early, you gain valuable time for proper evaluation and, if necessary, timely intervention. Knowledge truly becomes your most powerful tool in maintaining prostate health. Warning sign 1: changes in urinary patterns and function. The first and most common warning sign involves changes in urination patterns. To understand why these changes occur, let's briefly review prostate anatomy. Your prostate is a walnut-sized gland surrounding the urethra, the tube carrying urine from your bladder through your penis. When prostate cancer develops, tumor growth can compress or partially obstruct this urinary pathway, leading to distinctive symptoms. The most frequently reported change is difficulty initiating urination. Men often describe standing at the toilet waiting for urine flow to begin, sometimes needing to strain or push to start. This hesitancy occurs because the cancerous growth narrows the urethral passage, requiring greater bladder pressure to overcome the obstruction. Once flow begins, you might notice a weaker stream than previously experienced. What once was forceful now appears as a trickle or dribble. Another telling sign is the sensation of incomplete emptying. After urination, you may feel your bladder still contains urine, often leading to the need to urinate again shortly afterward. This occurs because the obstruction prevents complete bladder emptying, leaving residual urine behind. Consequently, many men experience increased urinary frequency, particularly troublesome during nighttime hours. Nocturia, waking multiple times night to urinate, can significantly impact sleep quality and overall well-being. The disrupted flow. Additional urinary symptoms beyond the primary symptoms. Men with prostate cancer often experience interrupted urinary flow starting and stopping multiple times during a single urination attempt. This stuttering pattern occurs as the bladder struggles against varying resistance from the cancerous obstruction. Some describe it as stopango urination, a particularly frustrating symptom that magnifies anxiety around bathroom visits. Additionally, many notice increased urgency, sudden, compelling needs to urinate that can be difficult to control. These urgency episodes may occasionally lead to urge incontinence, where small amounts of urine leak before reaching the bathroom. This symptom results from both physical obstruction and the cancer's potential interference with nerves controlling bladder function. Less commonly, men might observe blood in their urine as a hematuria, though this typically appears in more advanced cases, where the cancer has invaded the urethral wall or bladder neck. Even microscopic amounts of blood, not visible to the naked eye but detectable on urinalysis, warrant prompt medical evaluation. While these symptoms could indicate other conditions like urinary tract infections or benign prostatic hyperplasia (BPH), their appearance, particularly in men over 50, should never be dismissed without proper medical assessment. It's worth noting that early-stage prostate cancer often produces no urinary symptoms whatsoever, making regular screening particularly important for men in high-risk categories. When symptoms do appear, they typically indicate the tumor has grown large enough to impact urinary function, all the more reason for immediate medical consultation. Warning sign 2: pelvic and lower back pain. The second warning sign involves pain, particularly in the pelvis, lower back, or upper thighs. Unlike urinary symptoms that can appear relatively early, pain typically indicates more advanced disease, where the cancer has either grown significantly within the prostate capsule or begun spreading beyond it to surrounding structures. Pelvic discomfort often presents as a dull, persistent ache in the region between the genitals and rectum, the perineum. This pain frequently intensifies when sitting, especially on hard surfaces, as pressure directly compresses the inflamed prostate against other pelvic structures. Some men report that long car rides or desk work becomes increasingly uncomfortable, requiring frequent position changes or special cushioning. As the cancer advances, it may infiltrate nearby nerves, particularly those running through the pelvic floor muscles or along the spine. This neural involvement creates distinctive pain patterns, sharp, radiating discomfort that may extend down the legs or into the lower back. Morning stiffness in the lower back that improves with movement might initially be dismissed as ordinary age-related discomfort, but when persistent and progressive, it warrants evaluation, particularly when accompanied by other prostate symptoms. The pain connection: why cancer causes discomfort. Understanding the mechanisms behind cancer-related pain helps distinguish it from more common causes of discomfort. Prostate cancer generates pain through several pathways. First, as the tumor grows, it creates direct pressure on surrounding tissues rich in pain receptors. Second, cancer cells release inflammatory chemicals that sensitize nearby nerves, lowering their activation threshold and amplifying pain signals. For men with more advanced disease, pain may indicate metastatic spread, most commonly to the bones of the pelvis and lumbar spine. This bone pain typically worsens at night and may initially respond poorly to over-the-counter pain relievers. It often has a deep, boring quality that men describe as impossible to reach with stretching or position changes. When prostate cancer spreads to bone, it typically causes osteoblastic lesions, areas of abnormal bone growth, rather than the bone destruction seen in many other cancers, creating a unique pain profile. It's crucial to recognize that many other conditions cause pelvic and back pain, from musculoskeletal injuries to kidney stones. However, persistent, unexplained pain in these regions, particularly when accompanied by urinary changes, deserves medical attention. During evaluation, your healthcare provider may order imaging studies like bone scans or MRI to assess potential cancer involvement in painful areas. Warning sign 3: sexual function changes and abnormalities. The third major warning sign involves changes in sexual function, particularly erectile difficulties, abnormalities during ejaculation, and decreased libido. The prostate plays a crucial role in male sexual function, contributing secretions that form approximately 30% of seminal fluid volume. Additionally, the gland sits adjacent to nerves and blood vessels essential for erection. When cancer develops, it can disrupt these structures and processes in several ways. Erectile dysfunction (ED) may develop gradually as tumor growth interferes with neurovascular bundles running alongside the prostate that control blood flow to the penis during arousal. While occasional erectile difficulties are common with aging, new onset, progressive ED, especially in men without traditional risk factors like diabetes or cardiovascular disease, warrants evaluation. Some men report changes in erection firmness or duration before complete erectile failure occurs. Another concerning sign involves pain during ejaculation or orgasm. This discomfort may range from mild discomfort to sharp pain in the penis, testicles, or perineum during sexual climax. This symptom occurs because ejaculation involves forceful contractions of the prostate and surrounding muscles, which can irritate areas infiltrated by cancer cells or inflamed due to the tumor's presence. Blood and other ejaculatory changes. Perhaps the most alarming sexual symptom is hematospermia, blood in the ejaculate. This may appear as slight pinkish discoloration or, in more severe cases, frank blood mixed with semen. While hematospermia frequently has benign causes, including prostatitis or minor tears in small blood vessels, its appearance in men over 40, especially when persistent or combined with other symptoms, raises concern for malignancy. Some men also notice decreased ejaculate volume, producing less seminal fluid than previously. Since the prostate contributes significantly to seminal fluid production, tumor infiltration can reduce its secretory capacity. Additionally, cancer blockage of ejaculatory ducts can restrict flow during climax, further reducing apparent volume. Beyond physical symptoms, hormonal changes associated with advanced prostate cancer may reduce libido or sexual interest. While decreased sexual desire has many potential causes, from psychological factors to medication side effects, its emergence alongside other prostate symptoms merits discussion with healthcare providers. It's important to acknowledge that sexual health concerns can be difficult to discuss, even with medical professionals. However, these symptoms provide valuable diagnostic information and should never be withheld out of embarrassment. Modern healthcare environments strive to address these issues sensitively and professionally. Many men wonder how to distinguish symptoms of prostate cancer from benign prostatic hyperplasia (BPH), a non-cancerous enlargement of the prostate affecting approximately 50% of men by age 60 and 90% by age 85. This distinction is critical because while BPH requires management, it doesn't carry the same potential consequences as cancer. The challenge lies in symptom overlap. Both conditions can cause urinary difficulties, including weak stream frequency and nocturia. However, several differences may help differentiate them. BPH typically causes symmetric prostate enlargement detectable during rectal examination as a smooth, firm, but elastic enlargement. Prostate cancer, by contrast, often creates hard, irregular nodules or asymmetric areas within the gland. Symptom progression also differs. BPH typically develops gradually over years with slowly progressive urinary symptoms that may stabilize for periods. Prostate cancer symptoms sometimes appear more rapidly and continue worsening without plateau periods. Additionally, BPH rarely causes the bone pain, weight loss, or fatigue that might accompany advanced prostate cancer. Laboratory findings provide further distinction. BPH may elevate PSA, prostate-specific antigen levels modestly, typically proportional to prostate volume. Cancer often causes more significant PSA elevation relative to gland size and may show rapid PSA increases over time. PSA velocity. Only proper medical evaluation can reliably distinguish between these conditions, highlighting the importance of regular screenings for men at appropriate ages and risk levels. Risk factors and prevention beyond symptoms. While understanding warning signs is crucial, recognizing risk factors helps place your symptoms in proper context. Age remains the most significant factor. Prostate cancer rarely occurs before 40, with incidence rising sharply after 50. Family history substantially increases risk. Men with a first-degree relative, father or brother, diagnosed with prostate cancer face approximately doubled risk compared to the general population. Race also influences risk profiles. African American men experience both higher incidence rates and more aggressive disease patterns than other ethnic groups. They may benefit from earlier screening, typically beginning at age 45 rather than the general recommendation of 50. Genetic factors beyond family history matter too. Certain genetic mutations, particularly in BRCA1/2 genes, significantly increase prostate cancer risk. Lifestyle factors play important but more modest roles. Diets high in animal fats correlate with increased risk, while those rich in vegetables, particularly tomatoes containing lycopene, appear somewhat protective. Regular physical activity may reduce risk, while smoking increases it. Maintaining healthy weight appears beneficial, as obesity correlates with more aggressive disease when cancer develops. While you cannot change genetic predispositions, lifestyle modifications represent actionable steps toward risk reduction. Regular exercise, Mediterranean-style eating patterns, and maintaining healthy weight may reduce not just prostate cancer risk, but improve overall health outcomes. If you experience any warning signs we've discussed, how might your healthcare provider approach diagnosis? The process typically begins with detailed history and physical examination, including digital rectal examination (DRE). During DRE, your doctor inserts a gloved, lubricated finger into the rectum to feel the prostate through the rectal wall, assessing size, shape, and consistency while noting any suspicious nodules, asymmetry, or unusual firmness. Blood tests typically follow, with PSA measurement being the most important initial screening tool. While PSA elevations occur in various conditions beyond cancer, including BPH, prostatitis, and recent ejaculation, certain patterns raise particular concern. These include PSA levels above age-specific thresholds, rapid decreases over time, or elevated free PSA ratios. Additional blood tests may assess kidney function and complete blood counts to evaluate for anemia that might suggest advanced disease. If these initial evaluations raise concern, imaging studies provide the next level of assessment. Transrectal ultrasound offers initial prostate visualization, while multiparametric MRI provides more detailed images that can identify suspicious areas warranting biopsy. Bone scans may assess for metastatic spread in men with significant symptoms or elevated PSA levels. Definitive diagnosis requires prostate biopsy, typically removing multiple small tissue samples using specialized needles guided by ultrasound or MRI. These samples undergo pathological examination to confirm cancer presence and determine its aggressiveness through Gleason scoring and other metrics. Treatment options addressing prostate cancer effectively. Treatment approaches vary widely based on cancer aggressiveness, extent of spread, patient age, and overall health status. For very early low-risk cancers, active surveillance may be appropriate, closely monitoring the cancer with regular PSA testing and periodic biopsies while deferring active treatment unless progression occurs. This approach recognizes that many prostate cancers grow so slowly that men may never experience symptoms or shortened lifespan. For localized cancer requiring intervention, several options exist. Radical prostatectomy, surgical removal of the entire prostate, offers potential cure, particularly with nerve-sparing techniques that reduce risk of urinary incontinence and erectile dysfunction. Radiation therapy, delivered either externally or through radioactive seed implantation, brachytherapy, provides another effective approach with different side effect profiles. For more advanced disease, androgen deprivation therapy, ADT, reduces testosterone levels that fuel prostate cancer growth. While not curative, ADT can significantly slow disease progression. Additional options for metastatic disease include chemotherapy, immunotherapy, and targeted treatments tailored to specific genetic mutations within the tumor. New treatment approaches continue emerging, including focal therapies that target only the cancerous portion of the prostate while sparing healthy tissue. These include cryotherapy as freezing, high-intensity focused ultrasound IFU, and laser ablation, offering potentially reduced side effects while maintaining oncological control. Conclusion: empowerment through awareness. The 3 warning signs we've discussed, urinary changes, pelvic back pain, and sexual function abnormalities, represent your body's important signals that deserve attention. While these symptoms don't definitively indicate cancer, they should never be ignored or dismissed as inevitable aspects of aging. Prompt medical evaluation allows for earlier diagnosis when treatment options remain most extensive and outcomes most favorable. Remember that prostate cancer, when detected early, ranks among the most treatable malignancies. The 5-year survival rate for localized prostate cancer exceeds 99%, a remarkable statistic highlighting the value of symptom awareness and appropriate screening. Even men with more advanced disease benefit from ever-improving treatment approaches that extend both quantity and quality of life. I encourage men experiencing these symptoms to overcome potential embarrassment or anxiety about medical evaluation. Modern diagnostic approaches emphasize patient comfort and dignity while providing crucial information that guides appropriate care. Share your symptoms completely and honestly with healthcare providers who are well equipped to distinguish concerning patterns from benign conditions. For all men, particularly those over 40, regular preventive care, including appropriate prostate screenings, represents the best defense against advanced disease. Through awareness, timely action, and proper medical partnership, the outlook for men facing prostate concerns has never been more positive.